It's inappropriate. Even the promoters of fluoridation now admit that the major benefits of fluoride are topical. So they got it wrong. They got the mechanism wrong for 50 years. Now they recognize that fluoride works on the outside of the tooth and not from the inside of the body. And when the promoters recognize that, that should have been the end of fluoridation right there. It makes absolute nonsense of using the water supply to deliver a toxic substance when, if you want it, you can brush it on your teeth. It defies common sense. And here's what Arvid Carlsson said about this. Arvid Carlsson is a Nobel laureate in medicine in 2000. He led the successful campaign against fluoridation in Sweden. And he's also written a nice little blurb for the book, which I'm thrilled about. It says, in pharmacology, if the effect is local, i.e. topical, it's awkward to use it in any other way than as a local treatment. I mean, this is obvious. You have the teeth there. They're available for you. Why drink the stuff? Why expose every tissue in your body to a known toxic substance if you can get the so-called benefit by brushing it on your teeth and spitting it out? I think I probably said enough to persuade most rational people, and some of you might want to go home at this stage. That's all that some people need. But there is more. Most of the fluoride used goes nowhere near the teeth. The tap water is used for showers, baths, washing the dishes, flushing the toilet, cleaning the car, and watering the garden. A very inefficient practice, unless, of course, the object of the exercise is to get rid of as much chemical of this chemical as possible. And that may well be indeed the exercise, because the chemicals used are not pharmaceutical grade. They're not the grade of chemicals that are used in toothpaste, for example. They are, in fact, the products of the wet scrubbers of the phosphate fertilizer industry. This scrubbing liquid, cannot be dumped into the sea by international law. It cannot be dumped locally because it's far too concentrated. But if it's purchased by somebody in the United States, I'm not sure about Britain, but in the United States this is the regulation, if someone purchases a hazardous product, it's no longer hazardous. It's no longer protected by hazardous waste regulations. It's a product. And these regulations go out of the window. So our public water supplies do the phosphate industry a favor by converting their hazardous waste into a product and then using it in our drinking water. And these fluoridating chemicals, 90% of them, have virtually been untested. They are the silicon fluorides, hexafluorosilicic acid, or its sodium salt, sodium hexafluorosilicate. Use silicon fluorides for short. These are man-made. They don't occur naturally. Neither of these chemicals, either in their pure form or their contaminated form, have been subjected to rigorous toxicological testing. Who's in charge? Well, in the United States, we have many, many agencies and professional bodies and other organizations promoting fluoridation. But we were interested to see if any of them said, we own this. I mean, if anything goes wrong, come to us. We'll pay your bills. We'll do this, that, and the other, or we'll give you compensation. So we checked into all the agencies of the Department of Health and Human Services. None of them, a lot of them promote it, a lot of them defend it, but none of them actually accept responsibility for it, including the Center of Disease Control, which is the agency most actively promoting fluoridation in the United States and is influential throughout the world. They promote it, and most of their employees are dentally trained, not medically trained and not toxicologically trained. They promote it, and they know little about the safety and do not feel obliged to keep monitoring the safety issue. The FDA, you would think the Food Drug Administration would have long ago regulated fluoride, considering it's the most consumed drug in American history, the most prescribed drug in American history, going to over 180 million Americans every day of their lives in their drinking water. It's never been regulated by the FDA. The EPA, Environmental Protection Agency, they have something to do with water quality. Don't they regulate, or don't they accept responsibility for it? No. The EPA regulates contaminants of water, which does actually give them a direct, indirect influence on this issue. But they don't accept responsibility for additives. They've outsourced the issue of additives to a private entity called the National Sanitation Foundation. It looks pretty prestigious with NSF. It's the National Sanitation Foundation, and if you check, they are the ones who regulate the chemicals. They're supposed to be in charge of the toxicology and the safety assurances, but in their documentation they accept no liability for any injury that's caused from what they're doing. So the answer to this question is, who has responsibility in the United States for this practice? No one. Who would you sue? Well, you'll be forced to suing your local council and or your local waterworks. You're down to that level. And all these people are doing this because they think that some higher agency is there to take the fall. No, they will take the fall when the axe falls. Not one single U.S. federal agency, public or private, accepts legal responsibility for health claims for fluoridation or for the safety of the chemicals used. However, the UK government is exceptional in this case. They do, in the Water Act of 2003, they take liability. They took the liability away from the water companies, and so if anything goes wrong, you sue the UK government. And so you'll be suing your fellow taxpayers if something goes wrong. The Food and Drug Administration has never regulated fluoride for ingestion. Its official classification is an unapproved drug. So thousands of jurisdictions are putting an unapproved drug into their water in the United States. It's never been subjected to randomized clinical trials. This is one of the things that the York Review brought out. There was no grade A study demonstrating effectiveness. And in particular, there was no study where the subjects and the controls were randomly selected, and that the examiners and the patients were blinded. That has never been done for fluoride in over 60 years. Nor is the FDA tracking safety, which would be very important. If the FDA did regulate this, then all the reports of side effects, which are routinely sent to the FDA on any new drug, by now there would have been thousands of anecdotal reports from citizens that they are very sensitive to fluoride and are coming down with a litany of different problems. Well, if the FDA was doing its job, there would have been thousands of these reports, and at the very least that they would have instigated some kind of scientific, government-funded scientific inquiry to see if these anecdotal reports were solid or not. It's never been done. That has never been done in America. It's never been done in Ireland. There's not one single health study has ever been done in Ireland. It hasn't been done in Australia, even though one of the government bodies recommended that it be done. It hasn't been done in New Zealand. It hasn't been done in any country that has fluoridated its water. In other words, even though there are thousands of people saying, I'm sensitive to fluoride, no government has attempted to put that on a scientific basis. The FDA does, however, regulate toothpaste. And this is the back of a tube of toothpaste in America. And it says on the left, drug facts. And it says, do not swallow. And it says, use only a pea-sized amount. And there's a pea-sized amount if you don't know what a pea looks like. In fact, the Fluoridation Forum in Ireland spent a whole page illustrating what a pea-sized amount of toothpaste looked like in their report, in their 280-page report, but they only spent 1.5 pages looking at the primary health studies on the issue, which is not surprising since Ireland hasn't done any. It says, this is the FDA required warning, keep out of reach of children under 6 years of age. If more than used for brushing is accidentally swallowed, get medical help or contact a poison control center right away. Well, that's the kind of statement that's come from the FDA for an issue that they take responsibility for, namely cosmetics. Now, what would then be what they should be doing for water? Well, as a pea-sized amount of toothpaste contains the same amount of fluoride as 1 to 2 glasses of fluoridated tap water, the FDA would require on every tap in every house, in every town that's fluoridated, only use 1 or 2 glasses of this water, and if your child accidentally swells more than 2 glasses,